ahead and start with the meeting. It's great to get back with you guys. We've had a 2-week lapse on our Wednesday webinars, and we're going to get started up now religiously with getting these going. Just a couple things I wanted to discuss with you. First of all, just a status update. We are working on the establishments of your grant agreements. I am reaching out to each of the organizations individually. I need to step up that process here, but we're going to get with you individually to negotiate your terms of your agreement. A couple things that you want to take a look at that we've seen a few things on is the percent on your retention. Retention, what we want to see is about 55% rate of return based upon your enrollments, and that's one of the things I'll talk with you individually and make sure that that's going to be doable for you guys. But with this program, we don't want to lowball our retention rate. We want to definitely put some emphasis on retention, and what we would like to see in the plan is about a 55% retention rate based upon your enrollments. And we are going to work with the CBS too. We don't want to put you guys in a bad position because this is a pilot project also. But for our planning purposes, that's one of the things I'll discuss with you as we reach out to you individually. So just to give you a heads up on that. And I'm hoping that by the end of March, we're going to have the grants executed. The program is rolling. The last couple weeks, we have been doing training with the DHS staff regarding orientations. And so we're getting the DHS staff, local staff, up and running for the recruitment and orientation process and the referrals. So then that's when you guys come in, is on after the referral process with that. So another thing that I want to bring up is keep on your schedule the 23rd of this month. We are in tentative, well, we're getting close to finalizing some plans for a CBO in-person meeting. And it will be held in Chicago. I'm not going to give you all the details, but I'm pretty excited. We're actually going to hold it at one of the CBOs that's selected that's got a really dynamic and fun process that they do in the mornings with their clients. And then we're going to have some meeting time there, and then we're also going to have some breakouts, and we're going to have the breakouts at the DHS office, which is real close to this site. So pencil that in on your schedule. I'm hoping to have something out to you by the end of this week on confirmation, but the 23rd, that you would have to be at this particular agency between 8 and 8:15 in the morning, so if you have to travel, keep that in mind. But I just wanted to give that information to you just as a placeholder for you guys, and more will be coming, by the end of this week for sure. At this time, I'm going to turn it over to Levi. Levi is with the Department of Commerce and Economic Opportunity, and he has been tasked to orchestrate our data sharing agreement responsibilities. We are doing a data share with DHS for this project, and what that involves basically is in their legacy system, it's going to be like a data dump, so we're getting specific elements from them once a month that's populating the WorkNet system. When they go live with their IES system, it will be a real-time data exchange with IES and Illinois WorkNet. And with this new IES system, Department of Human Services has some new requirements regarding their data security. So the slides that Levi's going to walk through, there's a lot of information. He's going to just highlight a lot of these slides. But these are for you to download in the share file and have your staff take a look at. And part of the requirement is that you have a sign-off documentation that you need to complete and return to Levi. And he can kind of go into that, further with you guys. But this is a requirement for our data exchange policies, and this is a reason this is what we're talking about right now, because for that we need to have this completed. So with that said, Levi, I'm going to turn it over to you.
Well, thank you, Tammy. I think she couldn't explain it any better. So before I start, I'm going to point out one thing. First of all, can everyone hear me? Great. Okay. In the documents that we have available for download, you will see that there is a security and privacy controls questionnaire. I am not going to go through that because a lot of that's way above my pay grade, and a lot of those questions should be directed to your IT staff. If you do have any questions about anything in that document, I'm going to provide my email address, which is right here. Please feel free to email me any questions. I'm going to compile them and get them to DHS so I can get clarification on it. I know a lot of people have had questions already. Okay, now going to the training slides. There's about 80 slides in these trainings altogether. I'm just going to go over the highlights because after reading through it, I realized I can break everything down into 4 simple lines here. Number 1, do not share confidential information. Do not store confidential information in unsecure locations. Do not ask clients to email their Social Security numbers, and change your passwords often. That's what all these are going to break down to, but we're going to go ahead and just run through some of the high points in here since this is what DHS requires. Also, if you have any staff that is not on this call right now and is going to be accessing the information, you can give these slides to them and have them sign the acknowledgments. They just have to review it and understand the information. All right, some of the training goals is what is the HIPAA security role and what are the identity protection policies. Now, the training goals that we're going to go through in this one is to establish the appropriate procedures for users, to inform the users about the identity protection policies regarding the use of Social Security numbers. The HIPAA requirements basically states that contractors develop and follow procedures that ensure the privacy and security of protected information, and this requirements apply to all forms, including paper, oral, and electronic transmissions. Now, a lot of this stuff they're going to be talking about regarding something that's called PHI that regards to, what is the term on here? Well, it's protected health information. So if you see that in there, that's what they're referring to through this document repeatedly. The HIPAA security rule is basically a federal legislation designed to protect the confidentiality, integrity, and availability of electronic protected health information. This is more detailed about the electronic protected health information and what some examples are. Now, as far as privacy and security, when they refer to this, they're regarding any secure paper media and any electronic media, and all of that both needs to be secured. The security standards basically states that protect an individual's information. Some of the security requirements is you need to ensure the confidentiality, integrity, and availability of all data and protect against any anticipated threats, and some of that information is asked for in that security questionnaire. Possible consequences of security violations is obviously risk to integrity of confidential information, loss of client trust, employee trust, and public trust, and having to report to oversight authorities. The next screen just has some of the violations, and you can just review that on your own. This is more details about the identity protection policy. And this is some information about what it entails in that protection policy, saying that Social Security numbers shall not be encoded, embedded on a card or any document using a barcode, chip, magnetic strip, or other technology. Also, whenever an individual is asked to provide a Social Security number, they shall provide that individual with a statement of the purpose and the purpose for which they are going to use that Social Security number. The next slides are some do's and don'ts with Social Security numbers. I'm going to go over some of the ones that pertain to your agencies. Number 1, do not publicly post or display any Social Security number in any manner. Do not require an individual to transmit a Social Security number over the internet. Do not print an individual Social Security number on any materials or send the Social Security number through U.S. mail, private mail, electronic mail, unless the state or federal law requires the Social Security number. Continuing on with this, do not collect, use, or disclose a Social Security number from an individual unless absolutely required. Do not require an individual to use their Social Security number to access or communicate through any website. Do not use a Social Security number for any purpose other than the purpose for which it was intended. Here are some of the do's for the Social Security numbers. Do limit employee access to Social Security numbers only to those employees that need to have such access. Do redact Social Security numbers from the information or documents containing them before public inspection or before copying. This next few slides just kind of explain the principles of data security, and basically that's to protect confidentiality and maintain integrity. Now this slide pertains to people that use laptops. For laptops, you want to maintain the physical security of the laptop and make sure the laptop has up-to-date virus protection. The next couple slides is going to talk about keeping confidential client information. Here's some of the information that is considered confidential, PHI, personally identifiable information, and any demographic information. Also, any child support payment information, federal tax information, and obviously the most important is Social Security numbers, which you may be dealing with a lot of those. This is just further detail about some of the information we just talked about. And this continues along about information about what Social Security numbers are and federal tax information and what information that comes from. The next slide is going to be what not to disclose. So do not disclose confidential information via the telephone, through unencrypted email, through as an attachment. If you throw any kind of confidential information away, ensure it is shredded, or do not leave it around so anyone can access it. You also want to be sure to physically secure any kind of printed documents that contain confidential information. The next couple slides are going to talk about password security. Basically, this comes down to do not give out your password. Also, choose a secure password. Most agencies have their own password requirements, so that information can be derived from them. There's also information requesting that in the security control questionnaire, asking what your agency's password requirements are. This is the one that just explains you need to change your password often, don't use the same password for multiple accounts, and don't share your password with anyone else. Now, when sending emails, please review your attachments to make sure there's no confidential information on there, and then double check the addresses to make sure that they are going to the right people. The next few slides are going to talk about encryption requirements, and these can basically be, if you have any questions about this, they should be addressed by your IT department. Now, this is going to talk about security breaches. Data breach is a security incident in which a sensitive, protected, or confidential information is copied, transmitted, viewed, stored, or used by any individual who is not authorized to do so. Security incidents can be caused by a mistake or a malicious attack. Now, most IT departments inform you about some kind of tricks hackers may be used, such as phishing emails or other requests for information. So basically, remember that you should never be asked to send any kind of sensitive data through email or through a website. If you do have any kind of security incident or believe there was a breach, I would first talk to your agency head, and then they would be contacting this person here, who's the HFS Security Manager, Carol Connor. Her information is in the slideshow, so you need to contact her. When reporting security instances, make sure that you follow all these rules. And just a few things to remember: never give out your password. Do not click on links or emails that come from people you don't know. Use encryption when sending confidential information. And if you suspect data has been breached, contact the security manager immediately. Now, this slideshow was for the document that was labeled the IES Certificate of Understanding. So you can actually sign and agree to that and send it back to me at my email address I listed above. The next slideshow we're going to be doing is the HIPAA and privacy policy training. And I'm going to have to switch over to that slide now. All right, this is the HIPAA and privacy policy training. This information is actually quite repetitive. A lot of it was covered in the other training, so we're going to kind of go over this in a high level. It is 45 slides, but we will breeze through this. This training covers topics such as the definition of confidential information, the basic requirements of the laws, and ways to protect confidential information and the consequences. These are laws that govern the confidential information. Feel free to research these on your own. There is some more detailed information at the end of this presentation, so feel free to go through that. I'm not going to read all these laws, but you can review this on your own. General rules of confidential information. All client information is confidential. Every employee must protect the privacy and security of client information, and the agent's clients include applicants and their beneficiaries. These are some of the examples of confidential information. Note there is more than just Social Security numbers included on this list. This is going to talk about the Health Insurance Portability and Accountability Act. A quick overview of HIPAA is that anyone who receives client information must comply with the HIPAA rules. HIPAA provides the most basic legal protections for health information. The next few slides are going to talk about protected health information. Protected health information is information that identifies an individual or relates to the health, payment, or provision of health care to an individual. It can come in a lot of forms, including paper, spoken, electronic, just like we talked about in the last training presentation. It can even include basic, non-medical information, including demographic information, email addresses, or any other information used to identify an individual. HIPAA governs how agencies can access and use the information internally, and when the agencies can share or disclose information with external persons or agencies. Some of the ways that can be disclosed is through consent. The agencies can use and disclose the information with the written consent of the client. The other way is through the treatment, payment, and healthcare operations of the agencies. I'm not sure if this is going to pertain to anyone, but it includes accessing the information to perform your job or for the determination of eligibility, which you will be doing. The third example may not apply since a lot of this is related to the healthcare field. Other situations where it's permissible to share information is requests from other covered entities administrating government programs or providing public benefits, which does pertain to you. Your entity as a recipient of the agent's client or the agency's client information is permitted to access and use the information only for the purpose for which it was shared. Authorized uses of PHI: never disclose the agency's client information to a person outside your organization without talking to your supervisor first. Use only the minimum amount of information necessary to perform your job. Now, the next few slides are going to define breaches. This was reviewed in the last training slide, but it reviews or goes over this again. A breach is defined as unauthorized access, use, or disclosure of information. Some of the penalties include disciplinary action, monetary fines, and imprisonment. There's further information about this if you want to kind of research it further on. This further breaks down some of the civil and criminal penalties involved with breaches. And there's some examples of what constitutes a breach, and there's one in here regarding a state employee, which I'm going to read to you briefly. A South Carolina state employee was sentenced to 3 years probation and community service for sending personal information about Medicare recipients to his personal email account. So it's good to remember that if you're going to be doing this information, always use your government account or agency account and never a personal account like Gmail. These are some further breach examples. Another example, you can violate the HIPAA law if you use the agency systems to look up the phone number or address of someone you suspect is having an affair with your spouse. You can also violate HIPAA law if you are just curious and use the agency system to access information about your friend. Also, if you use the system in any way that is not related to your job duties, you have violated the HIPAA law. If you use the client's name, birth date, and social security number to fraudulently obtain credit cards, this type of breach is punishable under HIPAA law for up to 10 years in prison and a $250,000 fine. The next few slides are going to talk about other breaches, including improper disposal techniques. If you print documents that contain personal information as part of your job duties, ensure that you are shredding these documents and not simply throwing them away. If you have lost or stolen information, that is also considered a breach. For example, if you leave your laptop in your car and the car is stolen, although your laptop is password protected and the hard drive is encrypted, you got to ensure that it's secured. A lot of people often write down their passwords and leave it on the laptop. That is not secured. These are further examples of breaches. For example, while performing your job duties, you learn that your neighbor is receiving Medicaid and is taking medication for depression. You tell this information to your spouse. This is considered a security breach as well. If you do suspect a security breach, you must report any suspected privacy breaches to the HIPAA privacy officer immediately. Examples of things to report are unauthorized access, use or disclosure, loss, theft, or improper disposal of papers or devices that contain personal information, and unsecured emails containing personal information. These are some of the rights of individuals under HIPAA. Feel free to review these on your own. These are HIPAA rights to accounting. You can feel free to review these on your own as well. They are in the training slides provided. These are other laws that govern confidentiality laws under HIPAA as well. And these are more Medicaid confidentiality rules and regulations. This is information about the Illinois Identity Protection Act. This is information about the Personal Information Protection Act. This slide regards the child support rules and regulations. This slide regards the Illinois Public Aid Code. And the last slide just contains other confidentiality laws. The next few slides are going to talk about how to avoid data breaches. Some simple steps you should take to secure confidential information is to lock your computer and always place documents containing any confidential information in a locked file. This includes thumb drives, printed documents, or any other media that contains confidential information. It's a lot of common sense stuff, basically. This just repeats some of the stuff I just mentioned. You also have to be concerned with the fax machine regarding confidential information. If you ever request information by fax, confirm that the recipient's fax machine is in a secure location. And as we talked about before, avoid sending any email containing confidential information, and do not use personal emails to send confidential information. Also be wary of using your personal devices to check emails, and do not download any confidential information on your personal phones, laptops, or memory sticks. This next slide just goes over a few things to remember. A lot of this we just spoke about before, so it's fairly repetitive. And if you have any questions about the HIPAA laws or any security questions or data breaches, here are the contacts to ask regarding that. Always talk to your supervisor first. Now that you've finished it, this is for the HIPAA and privacy policy training form, so you can fill that out, have it signed, and then send it to me at my email address. As I said, if you have any staff that were unable to make this call, you can give them these presentations, and they feel free to fill out the forms after they have read and understand the presentations and email them to me. And that's all I have for everyone, so I can hand it back over to Tammy now.
Okay, so Libe gave you the quick and dirty on data information. You need to really go through these slides with your staff. Anybody that is going to be accessing data relating to the EPIC program needs to review these. They need to sign the forms. And Levi, correct me if I'm on the forms. They're attached to this email also. The security and privacy confidentiality form is actually one that needs to be completed probably by your senior management, and I think it has to be signed by the CEO, and that is pretty complex form. So that's something. If you have questions, please refer to those to Levi, and he will get the answers for those questions. And then the other forms is I believe the external security awareness. There's two forms that need to be signed by the staff, and both of those forms basically relate to these slide presentations and says that you've reviewed the slide presentations. You understand what they're saying, and with the slide presentation. So it needs to be two forms submitted by each person in your organization that is going to be working with data related to the EPIC project. And once again, this is implemented because of DHS's new IES data system that is partially live now, and I think the rest of it's going to go live in June or July. So this is the reason for this. It's because we have to implement this process so that we can have the data that's going to be shared, between our systems. Now, the data that you're going to be looking at in the WorkNet system is pretty basic information on the clients. We are doing a data transfer from DHS to the WorkNet system, and it's pretty basic. So we're not really getting into a lot of the healthcare, child care information that is in the DHS system. So that's the reason these are very intense, is because of the HIPAA and a lot of the requirements that go along with that also. And I need to check, I may be wrong, but with you having completed this, I believe this would give you the ability to access as an external partner to DHS systems. So if you needed to do some verification, say, on SNAP benefits, that may offer you that opportunity. It's something that I need to check and verify. So it could be a plus on that side if you wanted to utilize it for that purpose also. So anyway, like I said, this is just a really quick and dirty. Please have your staff review this. Any staff that's going to be involved with it needs to complete those 2 documents and return it to Levi. There is an Excel spreadsheet that needs to be completed with all of your staff that's going to be involved with this project and that's going to be dealing with data. I'm going to go through and see. Yeah, you sent all of the forms back to Levi. And I think that's pretty much it on the questions. This was a really quick webinar. Next Wednesday, we plan on going over the policy and procedures manuals for the EPIC project and also the DHS role and responsibility for being an ENT provider on their side. I have one more question. For staff hired for the project in the future, should these forms be submitted? Yes, the forms need to be submitted. Once you have staff on and identified, you need to submit those forms and provide those to Levi. And like I said, once again, on the 23rd, put that on your schedule as a potential, tentative in-person client orientation that will be held in Chicago. One more question. Can we verify number 7 on the certification of understanding form? Levi, he says, leave that blank. Okay. So any additional questions you may have regarding this, please refer them to Levi, and he will be able to help you with that. And with that, that's it. You guys will be hearing from me. Like I said, the intention is to have these grants up and executed. We're actually doing orientations starting this month with DHS, actual client orientations. So we will be starting referrals. We may have some referrals going. It's going to be slow at first, but we will be starting potentially referring clients to you guys towards the end of this month. April and May will be test periods for this, and you should have received an email from me regarding your costs. Once the grants are executed, we will do a cash request for you based upon your actual costs, your startup costs. We need to know what your actual startup costs are for this, and then your anticipated costs for April. And once again, April's going to be a slow month, and we really don't know where these clients are going to go yet on the referrals. So, don't keep it, reasonable, I guess is what I'm saying, on your costs. Because once your grants are up and running, you can request cash, but it will be on a reimbursement basis. So you're going to have to show your expenditures for those upfront costs first, and then on a reimbursement basis after that. So can we have the location for the Chicago training? It's going to be right around the downtown area. Yes, and I will send that information out to you. Hopefully by tomorrow, Friday at the latest. Is there a list of DHS JTED representatives, points of contact by the LWIA that the CBO can call to build relationships? We will give you that information. Yes. It's different for each region and how they're administering it. What's happening in Chicago is going to be totally different than what's happening, say, in Region 5, which is like the Marion and East St. Louis area. So that information will be exchanged for you. This first meeting on the 23rd is just for the CBOs. I anticipate that we're going to definitely have, I want to have quarterly meetings with our CBOs, and we are going to be establishing a task force for the ground level activities. And then we probably will be breaking out too because the areas are so different. So Chicago, we'll probably have some meetings just with the Chicago CBOs, and I want to interject the DHS staff in that too, so we have those relationships built. And then the same way for the other regions, we'll be having meetings with the CBOs and the DH staff to develop those relationships. In-person, good question. I'm glad you asked that. How many people are invited for the in-person meeting? I would like to keep it at 2 per organization. It's limited space that we have available. So if we can keep it at 2 individuals for this first in-person meeting, if you need to have more, let me know. And if I have an organization that's just sending 1, then maybe we can up yours, to 3 or whatever. But let's try to keep it at 2 individuals per CBO. Okay. With that said, I think we're going to end this call and then expect some information from me regarding the 23rd this week. And then I'm reaching out to, like I said, each of you individually to get the grants established and getting that rolling. Have a great afternoon. And we will have a webinar next Wednesday. It'll deal with policy and procedures and responsibilities of being a SNAP EMT provider. Have a great afternoon. Take care. Bye-bye.